In Montana, we have about 12,000 deliveries a year. Of those 12,000 babies that are delivered, approximately 11% are born premature. And these are the babies that will go into the NICU. Here we take care of babies from the very tiniest of babies to the full-term babies who have problems.
Because your baby is being admitted to an intensive care unit situation, please keep in mind that the first time you see your baby, it might be really scary. Your baby may be hooked up to many monitors, IVs, on a ventilator with a tube down the throat, a tube down into the stomach, and most people have never experienced this kind of situation before. It presents itself as a very impersonal situation. We're trying to mimic what you would be providing if your baby was still inside. We're never going to meet what Mom can provide, but we can come really close. We will get you touching your baby as soon as we can. We'll get you holding your baby as soon as we can, but our first priority is to provide what your baby needs at the time.
Your baby may end up with what we call a UVC, or an umbilical venous catheter, which is an IV that goes into the baby's belly button. And in this line they can get the nutrition they need, medications such as antibiotics. We will also as nurses be able to draw blood from the line, so we won't have to be poking the baby's heels. It does not cause them any pain going in. The main purpose of the UVC is to simulate nutrition to the baby that the baby received while Mom was pregnant. If they are needing to continue on with IV antibiotics, then we will sometimes put in what we call a PICC line, which is a peripheral inserted central catheter. It'll go in one of the outer extremities. This is more of a long-term catheter. It's very small, it's very secure. They can receive antibiotics and IV fluids through that catheter as well.
Lab work can give us a lot of information that will help your baby, in that we can know how much oxygen are they getting. Is it enough? Do they need more? Do they need less? If they have ventilator support or some type of respiratory support, then maybe we need to help them breathe faster so that they get rid of a little extra carbon dioxide. And the blood work can tell us that. There's other things that we send to the lab as well. We can send not only blood, but we can send urine, we can send little cultures from the skin, things that help us know what's the matter with the baby and what is your baby's needs. What can we do to help your baby and support your baby while he or she grows up? When everything is said and done, our goal is for you to take home a baby that is healthy and you know how to care for your baby and that you can have a beautiful life together.
We allow visitors in the NICU, but our space is small, so we want to make sure that your baby has the right visitors at the right time. Certainly we want your baby to be held and to be cuddled by the people that you want your baby to be held and cuddled by. So when you're admitted, we will ask you to fill out a visitation contract with us. Take some time and really think about who are the people that you want to visit your baby in the NICU. Once those 4 visitors are selected, we will file your form in your chart, and when somebody comes to the NICU and wants to visit your baby, we will be asking them for some form of identification. When they first enter the unit, they come through our front doors and they will encounter a locked door. And that's not because we don't want them to be there, it's not because we don't want them to participate. We just want to be sure that the people who are within our unit are the appropriate people to have there. So just pick up the phone, identify yourself, let us know who your baby is, and we'll be happy to buzz you right in. We will ask them to wash their hands very thoroughly before they come in, and we'll also ask them to wear a yellow gown when they come in. Again, that just cuts down on some of the infection control, the germs that come in and out of the NICU.
One of the things that parents should know is that most of the premature babies do well. A baby that's 28 weeks gestation, premature, they do very well. 99% survival, 99% survival without any problems.